Good evening. My name is Giulio Belvis, and I am a doctor, a physician in public health, and I'm also teacher, assistant researcher at the Catholic University, and the manager of one of the biggest Italian hospitals called Policlinico Agostino Gemelli. I'm very honored to join to the initiatives of Lewis University that has organized such an outstanding program on nutrition and health that is targeted to our colleagues from Pakistan. And as you can realize, this video has been made here in Rome, in Italy. Now it's 5 p.m. on November the 14th, and you are going to see it in a few days later. But never mind, because we will also have an interactive moment on the last day of your training initiative. Let me start just to show you which are the most important points of the program that has been coordinated by colleagues of Lewis University in Rome and are part of this program. This program is made up by the lectures of colleagues that are experts in the field of public health, nutrition, and epidemiology, coming from the most important universities in Italy. But you also have experts that join to institutions that are located in Pakistan as well. Let give us just a look to the program that we have built up for your training initiatives. And as you see that there will be lectures dealing with the nutritional epidemiology, food science, and human nutrition, but also other intervention from the Food and Agriculture Organization there in Pakistan. And there are also other lectures dealing with undernutrition and obesity on the other side. And we are going to provide you with the essential tools which would help you to implement at local level, which are very interesting promotion plans on food that have been established and defined at the international and national level, and you are going to apply in your local communities. But we are also going to provide you with tools to evaluate. And such tools of evaluation are taken from free of charge programs that have been developed by WHO. One of these is EpiMap and EpiInfo. EpiInfo will be provided to you by Professor Giuseppe Latorre from University of Rome. So a very rich program and very targeted to help you really to locally act in the field of nutrition and health. I'm considered an expert on healthcare systems and on healthcare delivery. So let me start with a look to which is the main organization of the Pakistan Healthcare Service. And we can realize that there is in the public sector a very important role of the federal government that is sided also by provincial government. This is the public sector, but you see that in Pakistan and in most countries all over the world, there is also a role of private sector, which owns hospitals, general practitioners, ambulatories, and so on. Another point, when we start with health plans on nutrition, on public health, is to start from figures and facts. And as you can realize, if we compare the most important health indicators in the zone, including Pakistan and other countries just like India, Bangladesh, Nepal, Sri Lanka, and so on, you can realize that your country really needs to increase its own performance in the health sector. Look at the life expectancy. It is one of the lowest in your selected area. On the other hand, data dealing with the under 5 years old mortality rate for 1,000 people is the highest. So your country, according to these statistics that have been performed 6 years ago, so I guess that the situation now improved over these 6 years. The situation really needs to improve. We can look also at other indicators dealing the fertility, the population that is at higher risk for nutrition and malnutrition as well. So population under 15 years, 1/3 of the Pakistan population is under 15 years. The fertility rate, or as well data dealing with prevalence of injuries and other diseases. You see that as for communicable diseases, maternal diseases, perinatal diseases, and nutritional diseases, this is our field of interest, there is a prevalence of about 41%. So 41% of the whole diseases in Pakistan are covered by this topic. How to cope with these problems? I have in my mind an idea of an health sector that is wider than the simple organization and service delivery. So it's very, very important to include into the health system human resources, financing, information, technologies, medical technologies, as well as public health technologies, and the leadership and governance. In the field of public health, in the field of the relationship of nutrition with public health, it's very, very important to have a good leadership and a well-established governance system. Why is it important? Because we know from the words of one of the biggest well-known epidemiologists that we had in the last century, Geoffrey Rose, that if the main health determinants are social and are economic, thus the intervention to cope with the diseases that recognize these determinants, the intervention must be mainly social and economic. This is a very, very important paradigm in epidemiology. So why is it important? Why is it relevant? Because if we are going to look at the main intervention that your country is going to apply to face malnutrition and also other public health problems dealing with nutrition, and we start from the WHO health profile dated 2015 as for Pakistan, you will see that we start with the prevalence of various forms of malnutrition that are summarized by indicators. These indicators cover underweight, wasting, stunting, overweight, and so on. And you see that the starting situation in Pakistan can be considered not very, very good. And also behaviors that will drive to good nutrition habits, just like breastfeeding, says that only 5.3% of children below under 6 months are exclusively breastfed, low level. So, what is going to do your governance system your governance health system to cope with malnutrition, to cope with the problem, public health problem linked to nutrition. There is an approach that is spread in most countries all over the world. This approach wants to start from the Millennium Development Goals 4 and 5. So a plan that has been established at international level. And what your country is going to do is to involve local authorities, local intents to develop and to implement which are the strategies of the Millennium Development Goals in your country. These programs have been developed for acute malnutrition, and as you see, the success of this Millennium Development Goal at local level passes from community-based management approach. So this is a very, very important point. Let me conclude, let me finish my presentation with a paradox dealing with Pakistan living outside from Pakistan. For example, people living in UK. This is the situation dealing with obesity. So we are at the opposite point in nutrition, opposite from malnutrition. People coming from Asian countries or coming from countries like Pakistan, and we are dealing with boys and girls, are at higher risk of being obese or being overweight if compared with white people living in UK. So it means that we also have to consider situation at risk of obesity, the other side of the moon, okay, in countries like UK, where many people from Pakistan live, as you know, in deprived areas. And so this is a paradox for public health, which really witnesses that if we have to deal with social and economic determinants, the answers will be most of all economic and social as well. Have a nice course. Bye.